Welcome to the Dear Doc podcast, where we will discuss the business of running a dental practice with a panel of experts. Now, your host, Dr. Christopher Hoffpower.
Hey guys, this is Doc Hoffpower coming to you again from my studio here in Alvin, Texas. And thank you for joining us for another episode of the Dear Doc podcast. Now today we're going to be interviewing another one of our experts. Her name is Dr. Amanda Wilson, and she is an orthodontist. She owns a couple of companies. In fact, she and I are actually going in business together.
That's right.
Can't say too much about that right now, but she is an expert on telemedicine and also on orthodontics. Today, we're going to hear a little bit from her about what it is she does. So Amanda, take it away. Introduce yourself. Tell us a little bit about your background.
Sure. Hey guys, I'm Amanda. I am an orthodontist. You can see here, I'm in beautiful Honolulu, Hawaii today. Normally I broadcast out of my own home office. However, my home office is full of teenagers doing distance learning, sucking up my Wi-Fi. So today I'm at the Royal Hawaiian, which is fantastic. Luckily it's super empty, so I'm enjoying this. Glad to connect with you and tell you a little bit more about Straight Smile Solutions and how we help general and pediatric dentists and orthodontists launch, scale orthodontics in their practice and lower their lab fees. Fantastic.
Now, I should say with full disclosure, I don't actually receive any money from any of you using Amanda. And Amanda, you can confirm that, please.
True that.
However, I have bent at least her pinky finger back a little bit to secure you guys some really, really cool discounts. And I'll let her cover what that looks like. And I use her in my practice. I used to find that I spent a lot of time planning out these orthodontic cases. And sometimes I would say, and Amanda, you've been over my records, about 30% of the time I screwed something up. So
no, not at all.
Well, it wasn't necessarily like a huge bad thing, but it could have been more ideal. And I've gotten all my time back. I do teleconferences with Amanda, and she looks at the case. She says, what is it you're looking to accomplish? Have you thought about this? And she helps me to plan the case. I don't have to touch a thing. So I got my time back. And to me, if you guys aren't as busy as I am, I understand you doing everything yourself, but I'm super busy and I'm kind of lazy too. So if I can find a better way to do something that I don't have to work as hard, I'm always happy, which is one of the reasons why I wanted to bring Amanda on and talk to you guys a little bit about what she does. So Darlene, take it away. Yeah. Tell them about who you are, how you got to this point, and what you do.
Sure. And just to give you some props, the cool thing about your cases is that you really have a lot of interdisciplinary cases. And I really like that about you. You have an ultimate goal of maybe placing some implants, doing some cosmetic work. So you're looking for the big picture. So together we're working as teamwork to try to get the patient to the end goal, which is like a perfect smile, full mouth rehab, all that. The other great thing about the way you implement in your practice is that you really work strategically with your team and you delegate to your team when you can. And you have some really awesome team members that they know ortho.
I love that woman. Yeah. She's amazing.
I know, she's so great. And the cool thing about your team is that, you guys got to realize a lot of ortho can be done almost completely by your team. Yes, the doctor is the brains behind it, but the team can take the ball and implement it. And that's what we're here. We're here to train your team. If that's what you want, if you want to fully, do it yourself as a doctor, then that's totally fine too. We're going to help support you in the way that you want to do ortho. And if you don't know how to do it, we'll help you do it. But ultimately, what we do is we come into a practice, depending on what you're looking for, and we're going to meet with your team. We're going to meet with the doctor. We're going to look over any existing cases that you have and try to find ways to be more productive, try to find ways to get from A to Z without revisions and refinements if you're doing aligners. Try to find ways to just get it done most efficiently and in a comprehensive care manner from A to Z, hopefully perfectly without any hiccups. So that's our goal. Also, we take a look at the cases that you're doing, if you are already doing it, to see if there's cheaper ways you can do it, lower lab fees out there. And that's the ultimate goal, is to lower those lab fees. Because goodness, you guys, if you're not already realizing what's out there that you can do, you can slash those lab fees by 70%. And there's referenced earlier. There's some really cool stuff on the horizon coming out very, very, very shortly, like in a few weeks, very, very shortly. And we can't say too much right now. Sorry for the helicopter back there. Maybe
that was the
Wi-Fi
Men in
though.
Black. They're making sure we're not talking.
No, Hawaii Five-0 actually films, and you can look behind. Oh, it actually is the helicopter. I'm pretty sure that's Magnum's helicopter. So that just went by. So they come by and they do their shots, but that's the orange helicopter.
That's
so they're still working. Clearly not socially distancing, but yeah, we're here to help you lower lab fees. I am just so excited about everything that's going on out there, and I don't know how much you wanted today to talk about virtual consults and some of the other things that are happening.
I want to talk about the whole process. So let me tell people a little bit about what I was doing. So sure. I had variously used SureSmile, ClearCorrect, MTM, and I was getting started with Invisalign. And what I found was that the training wasn't really great for any of those programs. And one of the things I did is I didn't even know that Amanda had this service. I reached out to her because I knew she was an orthodontist, and I said, hey, can you give me some pointers? Where can I go to learn more? Because I know she's really giving with her knowledge, and she's not the kind of specialist who gets upset when GPs want to do some specialty work. And so I found her to be someone I could easily talk to. And she said, Chris, I actually have a program that I'd love you to try. And I said, well, that's very kind of you, but I like to pay for stuff. And if I can pay for it, she said, okay, I'll let you pay for it, half price. So full disclosure, I get a discount, but I've negotiated the same discount for you guys.
Yes, that is true. So everyone out there, if you just even want to get started and try a case, this is what I've worked out for all the Business of Dentistry listeners. All you have to do is you can contact me directly and just mention Doc or Business of Dentistry. And if you have any case, whether it's a new case, a progress case, ClearCorrect, Invisalign, you don't know what to use, braces, 6 month
Send
smile.
Her your problem children. If you want to be really impressed,
yes, give me your most difficult redheaded stepchild case, and I will find a way to hopefully fix it and get it done. And everything you tell us is completely confidential. Obviously you're letting me kind of joke around about your cases, but I would normally never do that, and without permission, everything kind of stays in this head.
First,
But you know what? We all have challenges. If you had me starting to do fillings and root canals, I would totally be like, what's going on? Because truthfully, I've only done one denture and one root canal in my whole life. So, but
how it goes though. We're all on Facebook and all these other social media sites, and everyone puts up their most beautiful work. And I find, particularly as a person who has influence over a number of dentists, I have to tell people about my failures, because I don't want people to see me and say, oh, well, everything they do is perfect. It's not, people. It's just not. But I find great people to work with on my team, like Dr. Wilson here, to help me to get to the level of imperfection that I can live with. If that makes any sense to you guys.
That's awesome. And yeah, and you guys, I've screwed up on so many cases too. This might be almost my 20th year in dentistry, but I've screwed up on quite a few ortho cases. I fully admit it. Hopefully I fixed them, but I was hired at one point for a year back in California when I first got out to be the fixer. So Western Dental would send me to all their offices that had screw ups, and I'd fix all their cases. So at this point, I've seen pretty much everything out there, and I can definitely help you fix it. Sometimes you might not like the answers on how I recommend that you fix it, but let's get it done. Let's give the patient options. We need to be using technology nowadays. There's just so much options for virtual consults, virtual check-ins, and especially now, if you're not able to come into your practice, I'm really feeling for you. So talk to me right now. Let's find a way to get things implemented so that you can still be in business, even if it's virtual dentistry. And I know that a lot of people are stressed out about that. They may be against it because fundamentally they don't agree with direct to consumer. This is not at all direct to consumer. These are your patients that you've already screened. You've done perio exams, you've done oral cancer exams.
Right.
Let's go through your cases and see what's there, because there's probably a lot of low-hanging fruit that's out there that could easily be a lot of removables, whether you're doing phase 1, functional appliances, airway appliances, sleep disorder breathing appliances, habit appliances, aligners, or you can go into braces as well. And that's, once you start doing it, it's hard to stop doing it, because, there's always going to be that patient that's like, I want to do braces, and it's really, really not that hard. And I think you found that too. It's not that
And
hard now
to
with
that, and to
computerized
that
dentistry.
point, we
Mhm.
were doing 6-month smiles,
Mhm.
and I felt like I just wasn't getting the kind of control I want. And we talked about this a good bit in full disclosure.
Yeah.
And I still love the company. I love the people there, but
Yeah, me too.
I found that the level of control wasn't great. And you said, well, that's because you're just leveling and aligning. This is actually really the
Yep.
first stage. I may be misquoting you there. So
You're
correct me if
totally
I'm wrong.
correct. No, you're totally correct.
That's
Yeah.
just leveling alignment. That is the first stage of orthodontics. And if somebody just wants straight teeth that aren't in the right places, it works well enough. But if you really
Totally.
want to have full control of the cases and you want to have these great results, you have to think a little bit differently. And that's where our conversation first started. And I said, well, is there any way I can learn? You said, well, I've got this great kit in a bag. And this is how things started, if you remember. And
Yeah.
so she sent me out this kit. I purchased this little kit that your team and you can go through the steps of how do you bend wire? How do you connect brackets? How do you do all of this stuff? And it's not to the level that the orthodontists get trained in. However, it really helped me to wrap my head around some of these concepts. I had a couple of epiphany moments, a couple of ahas, and I went, oh, that's what they were talking about. And
Right.
it made my discussions with Dr. Wilson a lot better because, and I'm sure you noticed it because I saw you smile whenever the light went on. We're talking about a patient. I believe it was Miss Florence, if you recall that case, the one with
I think so. Yeah.
number 7.
Mm-hmm.
And you said something. I went, oh, and we're going to do this, this, and this. And you went, yes. So
You got it.
It's really
Yeah.
cool because working with someone who knows this stuff well, who is sharing their knowledge with you and really isn't jealous of what it is that you're trying to accomplish or jealous of their knowledge or doesn't want you to jump into those waters because they're being protectionist. That's fantastic. And so all of you orthodontists out there who are not like that, thank you. All of you oral surgeons, all of you periodontists, all of you specialists out there, because I'll guarantee you the more that you teach your dentists, your GP dentist referrals, the more we see and the more we send you.
Yeah, and if there's any orthos that are listening to this, please don't get upset. You're welcome to contact me because I have a million ways you can also save on lab fees. And if you start collaborating with the dentist locally in your area, and I've helped a lot of orthodontists do this, let's start. Here's how you reach out to them. You can start a program just like I have. I don't mind. I'm glad you. There is 225,000 general dentists in the U.S. There's no way I can help them all. So please grow your network, create a study club, help the local dentists in your area. And in turn, if they have a hard case, they're going to send it to you because they trust you, because you're helping them with the easy stuff. And where that fine line is going to be different for everybody.
So Amanda, let's take a step back and let's talk a little bit about the process. So what it is you do is mainly you help with this ortho consult. You say, okay, this is what needs to be accomplished. What do you want to accomplish? What does the patient want to accomplish?
Correct.
And you formulate that. To do that, we have to send you good records. And so what records in this first stage of things do you like to receive? I know I send you everything you want, because you told me everything you wanted, so I sent you everything you could ever desire.
Bare minimum would be the 8 set of photos, your regular ortho set, which is no different than you're uploading to Invisalign already, or no different than Smile Direct Club already asked for. It's just ortho pictures. Here's the cool thing, fun tip. Even if your office is closed right now, there's tons of virtual consult apps out there. Even Invisalign launched their own as of yesterday. If not, you can create your own in-house one for free. There's a lot of different ways you can do it. And your patient can send you those photos. And you can start screening those cases today if you want to. We love to see the pictures, as well as, if possible, a pano is great, or some type of x-rays would be great. If you can't get that, that's fine. We'll start with just the photos. Sometimes we need something more, like we might ask you for perio charting. Occasionally something else, maybe a CBCT, but that's only if it's a really, really, really hard case.
Doctors who send you a CBCT on every patient, do you? No.
Yes, I do. Yes, I do. I'm like, why are you irradiating your patient? There's no reason for that. But that's a bit of a gray area, and it's going to be depend on case to case, but I don't see any reason subjecting your patient to irradiation if they don't need it. So yeah, so we take a look at that. We screen the patient. We find out what the patient's chief complaint is. We talk about what your goals are, and we come up with a treatment plan, what the options might be, what the approximate lab cost might be. There might be 5 different options, you know, and we can go over that about the approximate cost, and then you can go ahead and we can even train your team. So your treatment coordinator, your office manager, your back office staff on their own scripting. And I know we've done that a lot with your team, so that your team can take that now. It doesn't have to be the doctor. Sell the case, prepare the contract. And if you don't have paperwork, we have it all. Like, I've basically been collecting it over the last 20 years. So anything from oral hygiene instructions to food instructions for braces, aligner instructions. Obviously, if you're using Invisalign or ClearCorrect, most of that stuff is already turnkey and ready to go. But if you're using one of the other more off-label options, the cheaper options that are out there for an easier case, you're going to need to have your own informed consent and stuff like that.
Perfect segue. So
yes,
one of the things that really excited me about working with SSS is that the first day she said, well, how are you doing this? I said, well, you know, we're using Sure Smile, we're using ClearCorrect, we're using 6 month smiles. She said, okay, so I know you have a 3D printer. Why aren't you printing these? And I said, I don't feel like it. And I've done it a couple of times and I got failures and it really annoyed me. And she said, well, how about, would you give me permission to try to save you a little bit of money? I have some people I'd like to introduce you to. And so tell us a little bit about what you did in my practice for me and what you got my case cost down to and what you can do for
Absolutely. So there's a bunch of different options out there. And if anybody wants to contact me, I can send you the infographics and the different options that are out there. But basically, I call this the white label workflow, which is what you're doing, which is it's aligners that have no brand. So that basically means that it's just generic. And, you know, we can use the analogy if you go to Costco and you can buy Tide or you can buy Kirkland brand, right? So the thing about aligners is that they've been around for over 20 years. So now the basic functionalities of them are now, you know, the patents have expired. So we can move teeth, we can do attachments, we can add IPR, even bite ramps. A lot of stuff that's out there is available, just white label. Price point, let's say you own no technology at all and you just want to outsource everything. Price point's going to be as low as $90 per setup and $15 per aligner. And you can bring it down significantly more if you want to start 3D printing in-house. But my suggestion is to first outsource it all, you know, pay that 90 plus 15, but let's do the math. A 10 upper and lower case, if you're doing that, is $390 lab fee with redesigns included as well. Now, if you have to 3D print more, you know, like your patient wasn't compliant, it's going to be a little extra. So, I mean, it's not like Invisalign when you do comprehensive where it includes everything for 5 years, but you're also paying 25% of the lab fee. So if you can get, like, you guys have done a great job at working on compliance with your patient, making sure your patients are checking in, doing virtual check-ins sometimes even, so that they don't have to come into the office. If you can keep your patients, it is so awesome. And there's no reason, I know you guys are doing this too, starting to try to do the cases in just 3 appointments. Look at what the direct-to-consumer is. This is not direct-to-consumer. These are our own patients. We've done full exams. We've done oral cancer screenings. We've done perio screenings. We are actually taking the scan or the impression, and we're actually delivering the aligners, doing the attachments and the IPR. But if you do all that, everything else from there on out, assuming you have a predictable treatment plan, should be able to be monitored remotely. And then at the end, you just take off the attachments if you had them. 3 appointments, that's it. And orthodontists have been doing this for quite some time. There are some turnkey virtual monitoring programs that are out there, but they're really expensive. And it's really possible to do this free or very low cost as well. And so I'm happy to explain this to people. And I have a lot of YouTube videos, instructional videos, webinars on that as well. And they're all free.
Absolutely. So one of the things I want to bring up there is if you design these cases, and this is something I just didn't realize. So a lot of my cases, I kind of let them suggest, oh, hey, we need to do IPR here. We need to do IPR here. We need to do IPR here. I didn't realize that we could front load IPR in almost, what is it? Is it 80 or 90% of the cases?
Oh yeah, you can, did you say front load or did you say omit?
No, front load. In other words, if you're going to be doing the IPR, you can push it all to the first step, and then you don't have to do IPR for any of these visits, which means,
of course,
all you have to do is have photographs, and you look over the photographs when your team pulls them, and you say, oh, we're tracking really well. Everything's fitting. Does the patient have any complaints? No. And you don't go into the room for that visit, which is fantastic. But even better than that, with this remote monitoring, you don't have to see the patient in the practice at all. You can give them 4 or 8 sets of trays. Now, you guys know I'm the business guy. What is the average cost to turn around a room in a GP office? $15. Every patient you sit, you lose $15 every time you turn that room around. And so if you're got what was it, 32 is a decent sized case, 32 aligners. So that's 15 times 32. Check my math. Is that $480?
It's about like that. Yeah. And you're not even mentioning doctor time or staff time. Yeah.
So
it's a whole nother thing.
Guys, you're saving a lot of money doing it this way. So all in, most aligner companies are charging what? Between $1,400 and $1,600 per
1863. Okay. So yeah, from the high end, but well, that's with a discount. You must have discounts.
I'd already negotiated rates with the companies. I wasn't aware they're that high.
Yeah.
So and I think Invisalign, if I'm not mistaken, for their diamond members and double diamond members, it's $1,100 per case.
Yeah, you get 38% off. But I mean, that's impossible to get to be diamond unless you got multi offices, multi doctors.
It's absolutely, you have to be doing 200 cases every 6 months.
Yes,
if I'm not mistaken.
Yes. So, it comes out to like 3-4 starts a day every single day of the week. There's no way 3-4 comprehensive starts in aligners. That's like no way.
Wouldn't it be amazing if there was a company out there? I mean, not to name any names or say any prices because I can't do that. But wouldn't it be amazing if someone were able to give you just a little bit over the diamond price, but for every single case, whether you do 1 or 6 million?
What a great segue there. Yeah. And the good news is that there's a lot of new options that are coming out. Maybe they're in beta right now in the next few months. Perfect timing for when your practice gets launching again.
You know what this is?
What is it?
This is permission to invite people for a beta test from Florida and from Texas. I received clearance last night. So I can
go for it. You tell us about it.
I can kind of come clean a little bit here. So
go ahead.
There's a new company. Amanda and I are both invested in it, and it is called ProLine. And they have a series of aligners that the dentist does just like as if they're doing clear align or whatever. And that's called STX, or Straight Teeth Express. And they are taking beta testers for that program. I can't tell you anything else about the ProLine program because I'm verboten.
I happen to have a box right here. It just happened to be sitting here, luckily. Nice. This is the beta box. It's going to change a little bit. But yeah, all right. But yeah, no, you're right on. They are accepting beta testers. And if you're interested, you'll want to contact Chris because he's the one that's coordinating it.
Actually, they made a landing page because I talked to him about it. I said, are you sure you guys aren't ready to do beta? They said, well, we're not ready with ProLine yet. And I said, no. Just with the Straight Teeth Express. And they said, as long as they're from Texas or they're from Florida.
I think Texas and Florida. Yeah. And I want to show you guys, like, can you see the trim on this? Whoopsies, I got to move it over.
Are you going to talk about the proprietary trimming on those?
Yeah,
I don't know what you can talk about. I received my marching orders, what I can say.
I've shown enough demo videos. You can just see that the trim looks very familiar to some of the other things that are out there. Nice scallop trim.
Almost like they took the best of 2 different big name aligners and they crammed it into one.
And
I started my first couple of cases, by the way. My patients love them. They said they're so comfortable.
They are. They will feel very similar to some of the other aligner companies that are out there, nice and light. I think we're doing 10-day changes right now, but maybe we'll be able to ramp it up approximately. That's really up to you. But they have all the functionalities of some other aligner companies that are out there, including bite tabs, precision cut. If it exists, you can do it with ProAlign. So we're calling it ProAlign because ProAlign is the brand that we're working with dentists. And it's not only like an aligner company, it's also, they can help you with the marketing. They help to actually get patients in your office, which is something pretty unique.
But we can't say anything else about that. That's as far as we
Okay.
can go.
Now what I'm
So,
saying is they might help you with patients in your office. That's it.
maybe, but
Maybe.
the beta testers are not getting that yet, just so you know. So
Oh,
beta
okay.
testers,
Got it.
you can use them just like you would use ClearCorrect or Invisalign or AceLine, or whoever it is you use. And they're allowing me to put that out there now. So I'm going to actually have a link
Got it.
or a landing page where you can go and you can fill your information so that you know this is called the Founders Club. You guys will be receiving special treatment. In other words, you're going to receive a better deal than anyone else out there. And they've told me they originally wanted to do just 12 dentists. And I said, look, guys, what about everybody else who signs up or wants to sign up? You can upset some people. And I got permission to have it just open. So anybody from my group and anybody, I asked them to extend it to Nifty Thrifty dentists. And so I'll talk to Glenn about that. But anybody who signs up from those groups on this list, whether you implement now or in a year from now, you get a special deal. You become a founder, one of the first members
That's awesome.
of this business, which is really cool. So all that aside, back to where we were before. Reel that back in. Sorry about that little segue.
No, good.
But we were talking about different methods of doing aligners, and Amanda's company can actually support you through either just having the aligner segmented somewhere else and bringing them and printing them in your own office. She can help you to set up the relationships that are necessary to have them segmented in one place and then printed somewhere else. Basically, it's full service. It's just like you're ordering from somebody, but you're having to help them set the case up a little bit. So if you want to speak to that process and the prices
Sure.
are amazing,
Sure.
Really.
Yeah, like I mentioned, right now we're doing a free case for every Business of Dentistry member. As long as you mention Dr. Chris or Business of Dentistry, you'll get a free case. It's normally $199. That means we can help you with any new case, any in-progress case, your redheaded stepchild case, aligners, braces, phase 1. If you don't know what to do, we'll help you with that. Beyond that, we also have some pretty sweet discounts if you decide you want to have a membership. But let's start one step at a time, and we can start with that free case because I'm confident that we can help you with the case. We can save you a lot of money. We can meet with you up to 50 minutes, 50 minutes for that case. But however much time you need, we'll meet with you for that case to help you out. But yeah, I mean, we're here to help you save money. That's the ultimate goal. There are so many options that are out there. And like I said, I have a few preferences, ones that I really, really, really like, but I'll work with anything. If you tell me you want to do fast braces, that's fine. Whatever you want to do, there's pros and cons to every system, but let's do what you're comfortable with.
I don't suppose I can twist your arm and have you tell them the ones that you're most fond of, or would that be too much?
No, it's fine. I mean, definitely the most fond of it's not that I'm getting kickbacks from these companies because I'm actually not at all. I really don't agree with that. It's because it's predictable or it's cheap or a combination of both. So obviously for aligners, I love ProAlign. It's a newer company, but we've seen a lot of cases coming. Everyone's really happy. Invisalign's great. I still love it. I have a great relationship with them. It's just expensive. So if you're going to do it, you have to be like all in and get that. I mean, I think you really want it to at least be gold. So at least you can get that 8% discount and then it starts to be a little more palatable. Of course, it really depends on your own personal demographics. Also depends on what type of scanner do you have, because I know a lot of us kind of got screwed when we had Trioses or some of the other ones, Medits, and all of a sudden now we can't send them to Invisalign. Now keep in mind there are workarounds around that, so I can teach you a few tricks that I'm not allowed to mention. So you can still use other scanners and still send to Invisalign. It's kind of like a bumpy workflow. Woo! We're dropping my camera. This is what happens when the wind comes.
I don't know anybody who might, because I might be able to say this if I just, you can wink if I get it right. So I don't know anybody who owns their own 3D printer who might scan a mouth with a Trios and then print that mouth and then send it to Invisalign.
I do know some people who are doing it, to be honest, but they're complaining about it. So I don't see the point of that at this point now that there's new options out there, because that makes zero sense to me, unless you are already like Double Diamond or something like that.
We need to talk afterwards, because then I can hear about this new option. I'll keep it on the down low. Just pass it out to a couple of friends.
Yeah, for sure. But and in terms of brackets, I mean, 6-month smiles is totally fine as long as you're okay with just the leveling and aligning, and that's a turnkey package, you know. I like that they're doing digital bracket placement. I totally support that. But beyond that, you can go to a lot of just local labs, and I think you guys are starting to do that too, where they will do it as low as $350 for the trays and the brackets. Really solid mini twin brackets. That's from metal, with torque prescriptions. It's like 022 Roth, which if you don't know what that means, it's really stable, really nice outcomes. If you want clear or ceramic,
means, I know where you can learn.
You can. Yeah, glad to tell you what it means. But yeah, you know, you can do great indirect bonding. I mean, you don't have to know how to place brackets. You just literally slap them on and like and peel it off. So, and then a couple wires and you're done. And we will help you tell you which wires you need. If you need springs, we just basically look at your case and be like, do this, do this, do this, and you do it. And you get from A to Z. But
okay, so she says that, but all right. So guys, here's what you get. I get these beautiful pictures with red arrows to brackets, and it says, move this here.
Yeah.
And so I do that. So one of the problems with these pre-made placed for you brackets, okay, where they print a little inlay and you place the brackets using that. Indirect bracket placement is fantastic until your patient knocks one off.
Exactly. You know, you can just trim the tray and trim that one little tooth out and rebond it.
So it's nice though, whenever that happens, or when something goes slightly awry, or let's say you put on a little bit too much composite, you end up intruding the tooth or lingualizing the tooth, I should say, or facializing the tooth because, you know, it was a little bit too far off of the center or whatever. That happens even with indirect bracket placement. If you want to really refine stuff, you have to know how these brackets work. And I've learned so much from you about how to place things. The other day, I walked in and I said, oh, that tooth needs to be intruded a little bit and brought a little bit more facial. Let's go ahead and pop that off. We're going to take off the composites. You want me to send it to Dr. Wilson? I said, trust me, I got this one. So
awesome.
I did that. I made sure I had a lot less composite, and I really pushed against the tooth when I was bonding.
Smush it on.
Extra out, just like you taught me. And it turned out beautiful. I was able to pull that tooth back into position, level it to where I wanted.
Awesome. I know exactly what case you're talking about. So very cool. I'm glad it worked out. That's great. So, yeah, you know, there's so much to learn, for sure.
Absolutely. So anyway, I'm just sitting here. I've got my admiration club for you going here.
Aww. Thank you.
So what do people need to do if they'd like to hear more about what Straight Smile Solutions does?
Sure. You can go to my website, which is straightsmilesolutions.com. There's a lot of free resources on there too. So we have literally hundreds of blogs as well as our YouTube videos. I think we have close to 1,000 now. And pretty much if you want to learn about something, I just basically create a video about it, from a technique with braces to phase 1, expanders, different types of aligner companies. If I don't have a video about it, just tell me and I will find a way to make it. So, but I mean, there's just a lot of free information right now. If you have a lot of downtime, this is the time to learn. We also have another website called letter P, like GP, webinar.com. And all of our major webinars have been posted on there. There's white label aligner webinars, phase 1 webinars. I have a posterior open bite with my Invisalign webinar. I mean, you name it. If it happens to you, it's happening to many people, and there's a solution for that. So beyond that, if you want to connect with us and redeem that free case, you can just go to the website, hit contact us, and contact me, and we'll be glad to set that up for you.
Fantastic. You know, I tell you, I've got to say, I was feeling so jealous here. Let me see. Did it come out?
So you playing with Zoom? There's grass. I have that one.
I was trying to get the
I don't think I want to be in San Francisco right now. You have the same ones I have. Yeah, I've used all those. But
I'm working on a new studio in the other room.
I saw it. Nice green screen.
Yeah. I ordered the one that was too small. I ordered one that's.
Oh, really?
This is what happens when you order stuff from China. I ordered one that was supposed to be 20 feet long by 10 feet high. I received one that is 10 feet wide by 20 feet.
Oh no. Uh-oh.
So it's like all over the floor and just right in the center of the green screen pole. So, but that's okay because I discovered there were some other things I wanted to do with that system anyway, so I could tighten it and make it really nice and crisp. But I started playing around with it, and there is one actually in a Hawaii beach, and you can see the waves coming in and the winds blowing the trees.
Cool.
That's kind of neat. I was trying to see if they had that one on this version of Zoom, but it didn't.
Hey, this is real. So
I know.
it's actually a nice day too. Fantastic. So, it's not even hot.
Guys, thank you again for joining us here on the Dear Doc podcast. And the last thing I'm going to do is I'm going to have Dr. Wilson close the show and tell us about what types of questions, since this is a non-clinical group, what types of questions she would welcome from you in the Dear Doc questions so that we can have her on again so she can answer your specific needs. So, Amanda, take it away.
Sure. I'm super glad to help you guys out with non-clinical questions as well. Like I said, I think cutting lab fees is probably the #1 question, no matter what you're trying to do within your practice. Utilizing staff more efficiently. Of course, every state has different laws and regulations for what staff can do, but I'm pretty familiar with a lot of them. If not, you can tell me how it works and I'll try to find ways so that we can try to lower your doctor time as much as humanly possible. There's a lot of really cool, I'm grabbing stuff out over here, procedures that can be done, especially on little kids. And I don't know how many of you like to work with little kids, but even if you don't like to work with little kids, I guarantee you that you have a staff member that's really great with little kids. You can do phase 1, you can do different functional appliances that are out there. You can bill either D8060, D8050, D8210, great way, and all this stuff could either be done theoretically remotely or your staff member can run the whole show. So a lot of stuff we can do to bring additional revenue into your practice. Remember now, tax refunds are coming in. Practices are hopefully going to start picking up in the next few weeks. Summer season's coming. This is the time to plan. If you don't like kids, let's get you liking kids, or let's find somebody in your practice that likes kids. And because there's a need for that. There really, really is. Getting started early, fixing bites, fixing airways. Let's talk about that. And yeah, saving money, utilizing staff, utilizing resources more efficiently, finding the right systems. But I'm open to anything. You can throw a question at me and hopefully I'll have an answer. If not, I'll get you the answer.
Just no clinical questions on the business of dentistry, but you can always
PM
Amanda, and she is very generous with her time.
Correct. I'll talk to everyone. And right now, it's pretty quiet. So let's do it. Keep me busy. That'd be great.
Good. So Amanda, if you wouldn't mind, get me those addresses for your different websites and where they can watch those webinars and those videos. And I'll post all of that whenever I post this as an episode.
Sure. Do you want me to say them right now or email them to you?
You can say them right now and email them to me, and then I'll make sure that they can either get it from the video or they can get it from the post. So
sure. StraightSmileSolutions.com, so StraightSmileSolutions, plural.com. Or for the webinars, letter G, letter P, webinar.com. And that's where all the videos are. And then once you go to either one, especially Straight Smile Solutions, there's various social media links, and you can go to my YouTube. That's a really popular channel because there are, I think, literally 1,000 videos on there and you could just search and put something in like expander, and all these videos come up on how to do it. Theoretically, you could totally not use me at all, and I'm totally fine with that, and just watch the videos, and you could probably launch a Scale Ortho on your own if you have the time to do it.
Fantastic. Well, guys, thank you for joining us for another episode of the Dear Doc podcast. And Dr. Wilson, thank you for joining us as our guest.
No problem. Thanks so much for having me on. Stay safe and healthy, everyone.
You too. Bye, guys.
Thanks for listening to the Dear Doc podcast, your source for the business and legal questions associated with your dental practice. Don't forget to subscribe to the Dear Doc podcast on all major platforms.